Let's dive right into this explainer. Today, we're unpacking healthcare's most powerful communication tools, action verbs. You see, in healthcare, picking the exact right verb doesn't just prevent errors, it literally saves lives. So, that begs the question, are you actually using the right verbs in your daily charting? We'll break this whole thing down across communication, procedures, and the pharmacy. First up, communication and assessment. This is where we build trust and gather that crucial data. Notice how we'll generally assess symptoms, but we specifically examine physical wounds in hospitals or clinics. And wow, there's a huge clinical difference between just informing a patient and explicitly instructing them, right? Also, before jumping into any treatment, we often need to reassure nervous patients to ease their anxiety. Then, to nail down a diagnosis anywhere, we systematically rule out issues before we confirm them. Moving on to phase 2, clinical procedures. This is all about those hands-on, high-stakes physical interventions. The pacing really quickens here. We administer injections, insert catheters, and carefully suture wounds. A typical step-by-step flow might look like this. First examine, then irrigate, and finally suture. Over in dentistry, there's obviously a massive clinical distinction between extracting a tooth and restoring it. Dentists use highly specific action words like scale, polish, and drill to document exactly what happened. But in a critical hospital emergency, the absolute highest stakes procedural verb we document is resuscitate. Phase 3 hits the pharmacy. These verbs demand absolute accuracy, safety, and literally extreme vigilance. Think about a medication's life cycle. It flows perfectly from prescribe to verify and finally to dispense. Pharmacists might also compound medications, meaning they whip up a customized solution for very specific needs. And they absolutely must document whether they substituted a med with an equivalent or simply refilled it. They're also constantly calculating doses, adjusting plans, and strictly counseling patients on how to use them. Finally, phase 4, tracking patient outcomes. This is where we document the final results of care. Think about the difference here. Medications might just relieve your symptoms, but clinical interventions actively heal tissues. Consider a complete hospital journey.